Honorable members, we are now in consideration of the Employment Amendment number 2 Bill, National Assembly Bill number 79 of 2019 by the Honorable Gideon Kater.
Clause 2.
I propose the question that clause 2 be part of the bill. There's a proposal by him to amend it. Yes, the Honorable Session is still on this one. There is a
Chair, faithfully on behalf of the chair of the committee and on behalf of the committee, on clause 2, we proposed an amendment of clause 2 by deleting the proposed new subsection 5 and substituting thereof of the following new subsection, that in respect of recruitment, an employer shall not require an employee to submit any clearance of compliance certificates unless such employer intends to enter into a contract of service with the employee, provided that an applicant of a state office shall provide compliance or clearance certificates at such times in the recruitment or approval process as they may be required. Chair, we had clear grounds of justification that whereas a clause has been redrafted to offer clarity, whereas it is necessary for an employer to require an applicant to submit the compliance or clearance certificates as a condition for confirmation of employment, the requirement should not be used to lock out applicants at the very first instant of recruitment or application. We felt it was a unnecessary barrier and on young Kenyans. An employer ought to show some serious interest in recruiting the applicant before requiring him or her to incur any cost associated with the procurement of clearance of compliance certificate and not lock out an applicant who does not provide these documents at the initial stage or interview stage. This move will greatly benefit the youth, as the majority job seekers who have limited resources are yet to incur hefty cost associated with the sourcing of these clearance certificates without the promise of securing the job. Chair, we consider that majority of these applicants are very poor and cannot raise any levies, and requiring them to raise any levies is actually unfair. Chair, the committee observed that there was a difference between compliance and clearance certificates. Some institutions issued either type of certificate depending on the nature of the applicant. The clause is therefore redrafted to include both compliance and clearance certificate. And thirdly, Chair, the provision in clause 5 is necessary to ensure compliance with Chapter 6 of the Constitution of Kenya. This is because, unlike regular recruitment processes, the process of appointment of a state officer is rigorous and elaborate. It comprises various approval stages by different authorities and bodies, and as such, it should be possible for the ethics and integrity requirements to be ascertained from the first stage of approval as well as at any other stage of the approval process. Chair, we considered redrafting that clause, and we propose that the redrafted clause be adopted by the House. Thank you, Chair.
Honorable members, I propose the question that clause 2 be amended as proposed by the committee. The Honorable Kater, you'll have the first go at it because it's your proposal. Or if you are not ready, we can have the Honorable Lesuda Naisula, who seems to be ready, the member for Samburu, as you put your thoughts together, the Honorable Kater.
Thank you, Chair. And I just want to thank the committee for this clause and to say that it is a clause that is long overdue. As a country, we know that young people, most of them, are just fresh from campus or colleges. And Mr. Chair, they have gone through school with a lot of difficulties. And then again, we are asking them for these clearance certificates and even add a cost to it. So I think this is something that is very important, and I support. Later is to follow up that the implementation of it is actually done accordingly to how we will pass it here in Parliament. Thank you.
Very well. The Honorable Oluwachitom, member for Mathare, do you have something to say to this?
Honorable Speaker, I am waiting for the next one, which is the Community Health Workers Bill. Sorry about
Very well.
that.
Very well. The Honorable Dan Manzo, member for Makueni.
Without the benefit of hearing what the Honorable Keter was to say, I have left with no choice but to agree with the amendment. Mr. Chair, there should be no factors which affect job seekers. It should be made as easy as possible for job seekers to access jobs, and unfortunately that has not been the case in this country. There have been so many cartels, so many corners, a lot of corruption. Even for somebody to get to police, army, those things, those recruitment courses have been a problem, and therefore, owing to the fact that many Kenyans who go to school, their only way to help their families is through employment at the first instance. They are not able to start their own businesses. I really want to support the position of the committee. I thank you, Chair.
The Honorable Martin Owino, do you wish to say something to this? Very well. Honorable members, allow me then to put the question. The Honorable Keter, are you now in a position to say something to the proposed amendment to your
Yes,
proposals?
thank you, Chair. Although I'm in support for the committee amendment since it is enriching the bill, and it is true. We are not graduating criminals. We are graduating Kenyans who are qualified, and they should be considered first for employment before they're being asked for any other hindrances apart from that, the normal certificate they get in school. We had created unnecessary hurdles only for job seekers and preventing them from actually getting gainful employment and being taken as cash cows. So I support the committee amendment.
Very well. Honorable members, then allow me to put the question that clause 2 be amended as proposed by the committee. Will as many of that opinion say aye? Will as many as of a contrary opinion say nay? The ayes have it.
Title.
I propose the question that the title be the title of the bill. There's no amendment to this. The Honorable Session, what is out of order? Yes, the Honorable Session.
Chair, and I'm sure Honorable Keter can agree with us. The clause 2 actually was in two parts. 2A, and we've gone through 2A, there's 2B. So I'm not sure whether we have adopted. If it is adopted, if the amendments for both 2A and 2B have been adopted by the chair, I stand guided.
We put the global question. The Honorable.
Yes, both sections I'm in support.
Yes. Very well. Thank you, the Honorable Session, for clarity. We will now put the global question in regard to clause 2. And the global question then would be that clause 2, as amended, be part of the bill. Will as many as of that opinion say aye? Will as many as of a contrary opinion say nay? The ayes have it.
Title.
I propose the question that the title be the title of the bill. There's no proposal to this. I therefore now put the question that the title be the title of the bill. Will as many as of that opinion say aye? Will as many as of a contrary opinion say nay? The ayes have it.
Clause 1.
I propose the question that clause 1 be part of the bill. There is a proposal to this, the Honorable Session. Your dilemma, understand it is a misdirection on my notes, but you have no proposal to this. So, yes, it is just a typo on my notes. So you are well, you are fine. You don't have a proposal to this. I will now put the question that the clause 1 be part of the bill. Will as many of that opinion say aye? Will as many as have a contrary opinion say nay? The ayes have it. Okay, we are done with that, so we shall move to reporting. The Honorable Gideon.
Honorable Chairperson, I beg to move that the committee do report to the House its consideration of the Employment Amendment Bill number 2, Bill of National Assembly Bill number 79 of 2019, and its approval thereof with amendments.
I put the question which is that the committee do report to the House its consideration of the Employment Amendment number 2 Bill, National Assembly Bill number 79 of 2019, and its approval thereof with amendments. Will as many as of that opinion say aye? Will as many as of a contrary opinion say nay? The ayes have it. Honorable members, we shall now have reporting on the Industrial Training Amendment Bill, National Assembly Bill number 4 of 2019.
Thank you, Honorable Speaker. Honorable Speaker, I beg to report that the Committee of the Whole House has considered the Industrial Training Amendment Bill, National Assembly Bill number 4 of 2019, and approved the same with amendments.
The mover?
Thank you, Mr. Speaker. I beg to move that the House do agree with the committee in the said report, and I request Honorable Shamala. I request Honorable Shamala to second the motion for agreement with the report of the committee of the whole House.
The Honorable Shamala.
Honorable Speaker, I do second.
Honorable members, I now propose a question which is that the House do agree with the committee in the said report. Honorable members, I direct that the next step will be undertaken when the matter will be set down in the order paper again, and direct that we move to reporting of the next bill, which is the Employment Bill number 2, as National Assembly Bill number 79 of 2019. The Honorable Wangwe.
Thank you, Honorable Speaker. Honorable Speaker, I beg to report that the Committee of the whole House has considered the Employment Amendment number 2 Bill, National Assembly Bill number 79 of 2019, and approved the bill with amendments.
The mover, the Honorable Ketel.
Honorable Speaker, I beg to move that the House do agree with the committee in the said report. I also request Honorable Leisuda to second the motion for agreement with the report of the committee of the whole House.
The Honorable Leisuda.
Thank you, Mr. Speaker. I second and thank Honorable Keter for this very progressive amendments to the bill, and also the House for supporting, as it is going to help our young people in a great deal, since these certificates just don't cost money, but even the cost of traveling to get them has been a hindrance for the young people. So I support, Mr. Speaker.
Honorable members, I propose the question, which is that the House do agree with the committee in the said report. Honorable members, I direct that the next steps in regard to this bill be undertaken when the bill will be set down for consideration again in the order paper. And I want to congratulate you, the Honorable Gideon Keter. This is the very purpose for which you are in this House, and I think it is great to see this kind of proposals emanating from you. And the Honorable Jude Jomo, that's great work. You are helping the children of this country to improve themselves. This is the purpose of this House. I'm grateful to be here when you are making your proposals. Thank you. I direct that we move on to the next business, the Community Health Workers Bill.
Order number 10, the Community Health Workers Bill, National Assembly Bill number 30 of 2020. Second reading.
Very well. Honorable members, this bill by the Honorable Martin Peter Owino, member for Ndiwa. The following members had spoken to it. That is, of course, the Honorable Dr. Martin himself, the Honorable Dr. Nyikal, the Honorable Sharif Nasir, the Honorable Ndindi Nyoro, the Honorable Badi Twalib, the Honorable Yusuf Haji, and the Honorable Mwashetani had spoken to this. So we will start off with the Honorable Odwoch Tom, member for Madare.
Thank you, Honorable Speaker, and I rise to support and lend my unequivocal support to this motion. I want to thank Honorable Martin Owino for bringing a very timely bill, and to say from the very onset that in light of what now is the universal health care, this bill could not have come at the right time. I want to begin by underscoring that, you know, community health workers are for a long time been unrecognized, largely working as volunteers. And if I used an example of my own constituency, in my own constituency, you have about 580 community health workers who work as volunteers, and in the entire Nairobi County, you have about 7,320. If you do the arithmetics and see the gap that needs to be filled in terms of human resource and the gap in the health profession, at least at the lower level where we have basic health care at our dispensaries, this is a crucial bill. The only thing that I need to add is that on top of it being said to be a money bill, it is important that this bill comes out very clearly and remove community health workers to people who just volunteer their time, and realize that community health workers are people like ourselves. They are mothers, they are uncles, they are aunties, they have children that they take to school, and therefore some form of remuneration is important so that they are also able to make a living. And then that brings me to clause 5, which happily establishes a council, and I believe and hope that over and above all the roles and objectives that I see there, the council will be able to do resource mobilization, both from the national government and the county government, and also to be able to look out to, multilateral donors, civil society, so that we are able to fill in the gap that the government is not able to fill, so that these people are able to work collectively and efficiently. Looking at clause 5, it is important to note that the establishment of this council will ensure that the council ensures access to qualification of, rather to assess, sorry, Chair, they'll be able to assess the qualification of community health workers, so that it's not just anybody who can appear today and say that they are community health workers. They will also be able to ensure maintenance of standards of practice, same as we have standards of practice for other professionals, the medical profession, dentist, poisons board, and all, the standards of how they need to be able to carry out their work, especially clinical standards that they will be able to offer at the lower level. It will also be able to establish a professional code of conduct and look at disciplinary measures, as well as to be able to keep a record and a database of how many community health workers I've just indicated in Nairobi alone. My count tells me that they are close to between 8,000 to 10,000 community health workers. But how many are there around the country? That database is important, so that even as we plan for universal health care, we are also able to see these people who offer a complementary role at the local level, how many are there? Mr. Speaker, I want to also indicate that the importance of community health workers can be looked at in 3 parallels. Community health workers are what to the health profession, what paralegals are to the legal profession, or what lay pastors are to the religious sector, or what Nyumba Kumi people are to the government at the lower administration level. And so their importance can neither be overemphasized nor gainsaid, Honorable Speaker. I also want to underscore that the role of community health workers to carry out functions that are person-centered. This is important because when you go to hospital, sometimes because of the pressing needs of time and the number of people that the doctors and health professions have to deal with, they don't have that one-on-one empathetic approach towards dealing with persons. And community health workers are able to go to the villages, to the households, and to be able to offer socio-psycho support. So this is the crucial difference that community health workers are able to bring. Community health workers are also able to address determinants of health at the local level, as they also promote access to health care to vulnerable people, for example, the disabled, the elderly, widows, and persons with HIV. This access is a crucial component of the universal health care, and that one can also not be overemphasized. Honorable Speaker, when you look at Article 43, when we talk about access, you realize that Article 43 of the Constitution says that every person has a right to the highest attainable standards of health care. And it also goes to underscore the question of access to emergency care and access to social security. Emergency care can be defined in different ways, but if I look at it in the context of informal settlements such as Madare, you will find that the local common person in my constituency in Madare and Mukuru do not have access to, for example, ambulances that can be able to quickly rush them to hospital during emergencies. Community health workers live with these people as in the person who lives next door. So they are able to offer that emergency health care to the extent that they can be able to realize when there is an emergency of a person who is a neighbor, look for a vehicle, a motorcycle, or a bicycle, and be able to rush them either to the dispensary or to the Nini. The other issue which this bill happily looks at is a question of their training, and it talks about how to train them to perform their roles, both clinical, both socio-psychol, and therefore the enactment of this bill will be able to bring a crucial component that is missing and a gap that would be very important to deal with in terms of the universal health care. Community health workers, Honorable Speaker, also guide the community on health improvement and disease prevention. And this is in terms of being able to educate the people at the local level. They make visits to home, they initiate dialogue with household members, they determine the health situation and deliver key health messages and undertake necessary action. Honorable Speaker, when we ask ourselves who are community health workers, a community health worker is a member of a community who is chosen by the community, meaning that there is already acceptability that this is a person who is known, because in terms of offering community health at the local level, that trust that the person whom you're offering this socio-psychological support or clinical support outside of hospital needs to be somebody who trusts you. So these are people who are identified by the community, they live with community members, chosen by community or organizations to provide health and medical care within the community, and is capable of providing preventive, promotional, and rehabilitation care to that community. Honorable Speaker, some of the benefits also, as I continue to underscore, of the community health workers is to gain support from other organizations serving the community, develop trust on one in terms of interpersonal relation, and deliver services that are appropriate and based on a language that the people at the local level encounter. And so, Honorable Speaker, based on this, and given that our universal health care is about to take off or is taking off, Honorable Speaker, it is important that this complementary role, this gap that will be filled by community health workers, be fast-tracked, be implemented, and a budgetary framework be put in place so that we mobilize resources from national government, from county government, from international organizations, so that these people come out of that position where they volunteer their work, they are unrecognized, and nobody really looks at the importance of the things they make. Honorable Speaker, I support, and I hope that honorable members in this House will rise to the occasion and support the bill by Honorable Martins Owino, the member for Ndiwa. Thank you very much, Honorable Speaker.
The Honorable Wangwe.
Thank you, Honorable Speaker. Honorable Speaker, on the onset, allow me to say I support this bill, the Community Workers Bill 2020. Honorable Speaker, as I support this bill, it should be on record that my constituency has quite a number of health workers who are really struggling to keep up with the conditions that they are working in. Honorable Speaker, allow me to appreciate and thank the Honorable Owino for these wonderful thoughts he came up with, such that he is able to think on behalf of the very strong population of health workers. Honorable Owino has had a journey to come up with this bill, and it's our prayer that representing people and legislating on their behalf should earn you good results in August this year. Honorable Owino, it's our prayer, and engage the people of Ndiwa to make sure they again see you in this House next sitting, Honorable Speaker. Honorable Speaker, this bill is good, and it's good because it's going to address salient issues that are touching on community health workers. It's not good enough to say you pay salary, you pay them, but it's good enough to look at the all-round social well-being of an employee. This bill, Honorable Speaker, is going to look at the recognition of the health workers. It's going to address the issue of training of health workers. It's going to look at the licensing on how the community health workers are going to work. And in overall, Honorable Speaker, is going to address the regulation of their practice and provide for the establishment of the Community Health Workers Council. Honorable Speaker, when you have a council, you have an umbrella organization where issues can be discussed, all conversations can be done at a council level, and Honorable Speaker, this is a bill that is going to address that. Honorable Speaker, this is a bill that is going to broker between the county government and national government. How do we put policies at the national level and they are implemented at the county level? This is a bill that's going to address that. And Honorable Speaker, the issues of handouts, which, for example, some counties are paying health workers 2,000 shillings per month as stipend. Let us not pay them stipend of 2,000 shillings, Honorable Speaker. I want to appreciate my county government. That's a step in the right direction. However meager it is, it's a step in the right direction. But let us now give rise to a better view, a better way of addressing the issues of community health workers than before. Honorable Speaker, the pandemic of COVID-19 has just come in. Initially, health workers were just meant to be otherwise called midwives. They would only be assigned in villages to assist our ladies and our mothers to have children. But today, community health workers, Honorable Speaker, have gone and risen beyond when COVID came. Honorable Speaker, the only person who could address the issue of COVID to the villagers at home, myself, having come from the village of Bunyala in Sisore, where not everyone understands English and Kiswahili. It's only the village community health worker, Honorable Speaker, who could address my community people in our language to understand. Therefore, they are people who have now lived beyond just being people to support our mothers or our wives to have children, but instead, they are now people who are aiding in terms of helping the community should there be a pandemic. Therefore, Honorable Speaker, this group of workers, since they have now upscaled their responsibility, they need a council to look at them, to address their social well-being. How are they being managed? How are they being administered? How do you regulate them? And how do you coordinate them? How do you eliminate if there is one of them who is rotten? And how do you promote that who is very helpful in the society? Therefore, Honorable Speaker, this bill has come in handy, has come in on the benchmark of the COVID-19, an example we have seen. It is now a bill which we should all support so that, Honorable Speaker, those who can come up with the council and the composition as listed in this bill can really be supported. Remember, Honorable Speaker, Article 43 of the Constitution guarantees Kenyans' right to good health. And good health, Honorable Speaker, is not the good medicine we take. It's the steps towards taking that good medicine that addresses the good health, Madam Honorable Speaker. Therefore, the Constitution, although it is a social and economic right bill as being a social article, but it is also enforceable. We have seen yesterday, and I must thank our President for really moving fast and implementing the universal health coverage. His pledge to Kenyans has come to reality. We now have UHC in practice. We can see, Honorable Speaker, opening up of cancer centers which are very ultra-modern. With those cancer centers, Honorable Speaker, with UHC in force, Honorable Speaker, we need people to talk to, organizations like health workers, to talk to our people in the villages so that they can know you don't have to take Piriton in the village. Instead, if you feel to this condition, can you now move to the next hospital? Therefore, Honorable Speaker, the organization through which the Honorable Owino has done is going to be helpful. This is part of organizing, Honorable Owino has thought it well in support of the government's view in enabling universal health coverage to trickle down to the local common man. Honorable Speaker, with those very many remarks, I wish to support the bill and ask my colleagues to join me to vote for it when it comes to the final. Thank you, Honorable Speaker, and I support.
The Honorable Manzo.
Thank you, Mr. Speaker, for giving me an opportunity to contribute on this very, very important bill. Mr. Speaker, there are very many community workers in the realm of health across the country who, Mr. Speaker, have not been taken care of, and in most cases have been volunteers. Other than midwifery, which my grandmother did for free for many years in Makueni, there are many health workers, especially in Makueni also, who are volunteers. They work at the community. They assist people who are going to bring children to life. Who are going to make sure that more people are born. And a lot of times it's an emergency situation. The ambulances or the non-health workers are not easy to reach, and these people are skilled out of having been trained from generation to generation, and they know what to do in case of an emergency delivery and how to save the life of the mother and the child. There are also community health workers, and especially in the Ma community, and they have never told another community the secret in the event of snake bites, and there are so many in the country. And unfortunately, now there is no longer compensation, although I brought a bill to this house to make sure that people who have snake bites and die out of it or are injured out of it are compensated. When snake bites happen in many parts of the country, before anybody is given first aid or before they get to any hospital, these community health workers have been very useful, and in the Ma community, they have a plan or some treatment they administer. And even from a very dangerous snake bite, that person will never get admitted in any store, and they will not lose your life. Unfortunately, we have so many lives lost elsewhere for lack of that technology or community basic person who knows what to do in case of a snake bite, what to use, and how to save the life of that particular person. So these are very useful people, Mr. Speaker, who in a way now must be regulated, coordinated, probably trained, or they share that technology, most of it which is earned from traditions and from all the time and passed on from generation to generation. And it is not conventionally taught in health institutions or in universities or anywhere. But that community knows that knowledge, and they know what to do in the event of what sickness and how to prevent it. And ordinarily, it's usually on first aid basis before that person reaches a hospital, and a lot of times saves a lot of lives. So there have to be a framework of dealing with these people, and a lot of times they have gone unappreciated. A lot of time that knowledge has gone untransferred because they know what herbs to use where, to deal with allergy, to deal with situations which can be held at first aid level. And then if we had a way of getting them known in their communities, having some registries as has been proposed here, getting them trained and getting them to train others to pass this knowledge to others. And a lot of times getting them sponsored, Mr. Speaker, we will be missing something, and especially when you come to traditional medicine in this country. And I believe this is a very important bill at this particular time. And without repeating what the other two members who have presented before me have said, because there's no need for me to repeat myself, it will be very, very important to have a recognized system funded by the government, funded by the Exchequer. My only other issue with this bill was whether it also deals, with the county functions and the national functions. But I've been very well informed by the mover that there is also another bill in Senate similar to this. And when we move ours at the National Assembly, and Senate does is, they will meet somewhere and will be able to modulate and get a very good law to deal with the community health workers. And that was the only challenge I was foreseeing legally. And I've realized we have taken care of that aspect of that aspect of the law and of the Constitution. You realize that under Article 43, health is a right to every Kenyan, and the government is tasked, and ourselves, legislators, to make sure that this is achieved and we serve our people and we save lives, because the community health worker, what they do most is to save a life, and a life is so important it is good when it is saved. And that's why even at a higher level, there is training of first aid in schools, in primary school, in secondary school, so that you know what to do in the event of an accident in the village, fall from a tree, you know what to do. There could be even fall from a bicycle at that level there. What do you do to make sure that person survives to get to a place they can be taken care of and they can be facilitated? The health worker, community health worker has been defined, and the moment it is regulated, then it becomes much better, and the Kenyans will receive their health care. I must congratulate the president on what he has done in relation to the health care of this country. And this community worker is dealing at a lower level. He's done it at a different level. And it means when we pass this law, we are able to take care of the basic health from the smallest level in this country to the highest level in this country, Mr. Speaker. And I also want to say, earlier on, Mr. Speaker, we had experiences in this House where our insurance was very difficult. But currently, Mr. Speaker, I must really thank the administration of Parliament. It is extremely efficient, and the doctors are handling our people very well. If it is a member or the family, they are handled very well. So in conclusion, I really want to urge members to support this, and it facilitate, a way of making sure that the person, the basic person, is taken care of, and that particular health worker who has been voluntary for all the years can now be recognized and can earn something out of what they do, and can serve the community better and can be motivated through this law. I thank you, Mr. Speaker. I support.
The Honorable Mohammed Sheikh, you are next on my list, but I see you are you're ready. Proceed.
Thank you very much, Mr. Speaker, for your kindness and generosity for allowing to wait for me to rush to my microphone. Mr. Speaker, I stand here to support this very, very invaluable bill. I say it invaluable because we cannot put it to scale. The values it's going to add to the healthcare workers. Mr. Speaker, I speak from a point of knowledge in the sense that I've been in the health profession for the last 33 years. It means that, to me, this bill is timely, it is important, it will add value to our society. We have to know that the community healthcare workers are the backbone of our society. They're the ones that actually drive the health of our society in the rural village, far-flung rural village. It is important, we must acknowledge that these healthcare workers did not have a union, community healthcare workers, that is, they did not have a union, they did not have a council, they did not have representatives that actually voice their words into practicality. It has given them the opportunity on this bill. It has given them the opportunity to be able to air their positions so that they can describe the terrain they go through in their tarmac, in the sense that our community that are in the village have got the ears of these community healthcare workers. As well, the community healthcare workers have got the ears of the community, simply because they are informed of the actual medical conditions that are there. If a mother is in labor, at the wee hour of the night, doctors are not there to help them. The community healthcare workers live within the village, within the periphery and precincts of where actually things happen. And because of that, the community healthcare workers provide the essentials of medicine. And I will use the term essentials of medicine, simply because the practice of medicine is done by those that are quite up there in the ground. I mean, when I use the term medicine, some people are a bit territorial and they want to claim medicine is for particular cadres. Well, I want to say those who dispense the services provided in the rural village are those that actually practice the actual medicine are out there. Therefore, recognition of these community healthcare workers is a plus. It is a plus, and it is going to give them the opportunity to be able to prosper in their careers, to prosper in their salary and remuneration packages, to prosper in giving them that support that they need psychologically to say that they are valued members of the health professionals. They can only be valued in the community once they are recognized at the national level. in terms of advocacy, in terms of board that can be able to service them for all the requirements that they need in their documentation. Let me tell you why these people are very important. From my very own family, my grandfather, Mzee Omar, the late Mzee Omar, was a community health worker who was a traditional community health worker. He was actually a very, very bright orthopedic surgeon, traditional orthopedic surgeon. He used to do all the works that are required in the rural village. My mother was actually one of the best physiotherapists, traditional physiotherapists, during the times that she used to live in the rural village. She used to provide services to people who are ill in bed and give them that support that they needed. When the doctors are not there, when the community health care workers, the current community health care workers were not there. So traditional community health care workers also need to be recognized. That's what I want to add to Dr. Owino's proposal on this bill, to say that traditional healthcare workers or traditional community workers are also the most valuable people, not necessarily those who came through formal education to become community health care workers. But I also want to add on to this, that Mr. Speaker, when it comes into advocacy, we always lag behind when the voice is not there at the table where things are discussed and decided in. And that is why the community healthcare workers' situations were lagging. I am a particular beneficiary of the community healthcare workers. The entire immunization that was given to us in our childhood was actually provided by community healthcare workers. For many of them who were volunteers, who were unpaid, and many of them were actually unlettered. When I say unlettered, they were not formally educated, but they had the grasp of it. They had the grasp of it. In one of my chapters in my books on transforming public health in developing countries, community healthcare workers stand out. They stand out simply because of the works that they have done in Pakistan, they have done in Bangladesh, they have done in Nigeria, Ghana. These are the places that I have actually focused on in that chapter. If you look at Ethiopia, before the current crisis, the child mortality was actually, has improved so much so that we thought that they are in the first world as well. The reason as to why that has happened is because of community healthcare workers. And that brings me back again to say that they are the backbone of the society. Mr. Speaker, without dwelling this longer on the advocacy of providing a board and a support for the community healthcare workers, I want to say Dr. Owino must be congratulated for actually pushing our committee, as a member of the health committee myself as well, to make sure that this has been discussed, taken the public participation it deserves, gone through the process it requires through the committee, and then we came into that decision. The decision we came to support this bill is of a professional decision, of a decision that we as professionals in the healthcare service have provided to say that it is a timely thing for the community healthcare workers. They take care of our level 1 hospital, they take care of our level 3 hospitals, they take care of community health services, that is public health as well, in the community, within the community. And therefore, these are the guardians of our society's health. These are the guardians. And given that they are the guardians, then it gives us the imperative to support anything that is going to support them both professionally and as well as the journey towards progress in their careers. Thank you very much, Mr. Speaker. I do support this bill, and I do ask the rest of my colleagues to support this bill, given that it has come through the minds and the brains, the brighter brains of the professionals that are in the Health Committee. Thank you very much.
Well, the Honorable Kamene Joyce, member for Machakos.
Thank you, Mr. Speaker, for giving me this opportunity to contribute to this very important bill. I must say, I start by congratulating Honorable Owino for coming up with this wonderful bill, stating that in Machakos, we have community health volunteers. And there's no doubt we have seen the work they are doing in the communities. And with the much effort they have done, and more so during the COVID-19 season, we saw them come in handy. We had our teenage pregnant young girls, and we saw the way these community health volunteers worked and walked with our young girls, and also bringing awareness of the COVID-19 and the regulations, and more so in the funeral places where funerals were taking place, and also in the places where we had events. They came, they stood and carried the sanitizers and also masks, doing their best to ensure that COVID-19 was not spread. And even yet, after the work that we've seen them doing, we are very aware that they are very frustrated lot, and more so in the Machakos County area, where the little that had been promised to be paid have never been paid up to today. You'll find that they have arrears of 2 years. Why is that so? Because there are no regulations, there is no body that recognizes them. And that is why I say this bill comes at a handy and the right time. Congratulations, Mr. Owino. And we are aware, if this bill passes, that there will be clear guidelines. They'll be able to get trainings. They'll also be able to get licenses. And to perform their work will be made easier. So I want to support this bill as fast as yesterday. Thank you, Mr. Speaker.
The Honorable Joshua Kutuni, member for Cherengani.
Thank you, Mr. Speaker. Mr. Speaker, first of all, I want to take this opportunity to thank Honorable Hood Chief. He's a member of our committee. And Chair, I want to confirm to this House that Hood Chief is one of the most robust, most reliable members in the committee. And I also and also his experience talks quite a lot. He's been in this field of caregivers, social work for many, many, many years, not only in this country, but also in the US and other countries. So Hood Chief comes in with a lot of experience, and we appreciate his contribution all the time. As a committee, enactment of this is long overdue.
The Honorable Kutunyi, for just the education of the Speaker.
Right.
Wood Chief, I don't see any member in the House, not as Wood Chief.
Wood Chief
is a Speaker. Ward Chief, the son of the Chief.
Yes.
Okay, proceed.
It's another dynasty, but anyway, do I say?
Proceed.
Thank you so much. So, Mr. Speaker, this is going to go a long way in ensuring that we have people in the society that will be working very closely with the public to enhance quality, affordable health care. We use a lot of money as government to treat diseases. But, Mr. Speaker, it has come to our attention, because we've sat in the committee, but we've proven that prevention is much better than cure. If the government is going to put a lot of money on prevention through, awareness, we are going to eradicate diseases that, if left untreated, the government is going to pay a lot of money. Today, we are talking of hospitals which are overstretched. If you go to MTRH today, it is overstretched because it is covering the entire Western Kenya and also part of Uganda and Rwanda. Why? It is because we don't have early warning systems to deter these diseases. But having these people, it's going to go a long way. Community health workers, they are going to do capacity building, awareness, that is going to help the government reduce the cost. So instead of paying too much through UHC and to the hospitals, it is better to pay these people's salary and cut the cost of treating these diseases in the hospitals. See what has happened even in Kenyatta National Hospital. The same thing. Kenyatta University started just 2 years ago, but it's overstretched already. When we work on the budget, we don't have enough resources to ensure that we give to all these hospitals. So we should not be talking about expansion, but we should be talking about preventive health care. I think that is what is important as a country. What we need to do is how we need to create an enabling environment and an infrastructure where the national government and the county government are going to work closely. So then we ensure that the community health workers are given favorable conditions for working. They should be provided by the materials that are required. Like the way ECD teachers are being paid, why don't we pay community health workers? Because they go hand in hand. Mr. Speaker, so once it is enacted, I think it is also going to come to us again back to the committee where we're going to make sure that we factor in the budget. And I will appeal to the ministry that when they are going to do the itemized budget in the future, we want to see the salaries, remuneration for this. Right now, the government has set aside almost 870 million to pay those workers or to absorb those workers who've been working during this COVID-19, the front workers. First of all, they started with 3 months, 6 months, now 1 year, and then the government seems to going to observe those people. So then they can be part of the workforce to continue fighting against COVID and other diseases. So then we are going to challenge the government. And you see, when the money comes, these people, they are working for the counties. So we don't see any issue that is going to be very difficult from the national government and the county government harmonizing a framework where community health workers are going to be part or integrated to the national workforce. I think that is very important. So I stand here, Chair, to support that instead of expanding many hospitals, I think we need to focus on preventive health care. I think that is very important. So I thank you, Chair. Thank you.
Well spoken, the Honorable Kutunya. The Honorable Mule Mutinda, member for Matungulu.
Thank you very much, Mr. Speaker. First and foremost, I want to thank Honorable Martin Owino for bringing up this bill. Mr. Speaker, this is a very important bill for this country and for the health workers in Kenya, and especially the cadre called the community health workers, Mr. Speaker. Mr. Speaker, we have to realize that the serious gap which is caused within the healthcare by this missing link of the community health workers in this country. Community health workers play a very big role within the service delivery of healthcare in this country. And I want to say that this bill comes at a very anti-time whereby health services have been devolved to the counties. And it's very unfortunate, Mr. Speaker, to state it and to put it on record that not only Machakos County, but several counties within Kenya have neglected these health workers, community health workers. And it's the high time as members and representatives of the people and House who we are mandated to come up with this legislation to make sure that this gap does not exist anymore, pass this bill in a supersonic speed. Why am I saying we need to pass it in a supersonic speed? Mr. Speaker, in my county, Machakos, we meet these healthy workers, community health workers, in every function we go. But at the end of the day, as a member of parliament or as a leader, you end up looking back on how to make sure that they get transport back home, and when he gets back home, at least he has something on the table. And this is the reality, Mr. Speaker. So, Mr. Speaker, I want to say that as a House, we, through the leadership of this House, Honorable Wangwe is here, can you find a quicker method to fast-track this bill so that it can be enacted to law before we start even finalizing the itemized budget for healthcare in this country for this financial year, so that we can take care of these health workers within the budget which will be read in this House, and provide money for them to be paid like any other health worker. It is highly important, Mr. Speaker, that if we fast-track this bill, I'm very sure we'll be able to realize universal health coverage in Kenya without looking for any other models to implement the universal health coverage. I want to urge those governors who have the heart of Kenyans within themselves to make sure within their county government they put aside some money to take care of the community health workers. And I know when they come back, they will tell us, oh, you have not passed the legislation, you have not passed the regulations. I want to tell them now, the holiday is over. We are going to push this bill to make sure that they have the regulation required, they have the legislation required, and we take care of Kenyans at the candor whereby those Kenyans who probably God has given them a good health for many years, they can also enjoy the services of these community health workers. Last but not least is that the community health workers require some essential commodities to facilitate them to do their job. These commodities must be factored in this year's budget. Because if we have the staff, we have the community health workers, and we don't have the essential commodities, we call them in the health sector the essential commodities for health workers, whereby they have a bag, they have the gloves, they have, and must be taken care of within the budgets we are making, Mr. Speaker. So I want to say that this is an holistic bill which brings the health thinking in this country in a different format, in a different way, and in a different approach. And I want to urge my colleagues, let's move with speed. We get to the third reading of this bill. As I've urged the leadership of the House, fast-track it. We don't have a lot of luxury of time. We fast-track it, we go to the third reading, we finish with it, we send it to the President for assent. Because I know by the time we get there, the bill from the Senate will be ready, and it's a matter of harmonizing the two bills and bringing it back here. We pass them, and they go to assent. We have attended several meetings with Mr. Owino. We had a meeting on Zoom, which was organized by, through the Ministry and Kanko. And he spoke about it at an international level, whereby our colleagues from Canada are shocked that Kenya, we are making a milestone to take care of the missing gap, not only in Kenya, but in the entire world. So I want to thank you, Owino, because we'll go into the books, Guinea Books of Record, of realizing a gap within the health sector and curing it through a legislation. Congratulations. Last but not least, Mr. Speaker, is that the county governments, with all due respect, must, and they need to be put on notice, they must clear their bills with the organization called KEMSA. If you look at KEMSA, is not able to provide the essential commodities required right now because the counties, they pick goods, commodities from KEMSA, and the counties are not paying. We must be a country whereby we are accountable. The governors who are picked goods from that organization, and they have not paid, they are doing a disservice to this country. Because we saw it on the TV the other day, the acting CEO put it very clearly, that they have a bill of almost 7 billion shillings with the counties. I want to suggest this, Mr. Speaker. As we are dealing with the budget for this year, we allow the Ministry of Finance and Treasury to deduct all the pending bills from the county money before they send their money to the counties, so that we can make sure that we restock our reserve for medical services, for medical commodities in this country, and we make sure that we don't get into quagmire of having a warehouse which does not have commodities. Please, governors, can you pay your bills? And I find it very funny, Mr. Speaker. Most of these county governments, if you look at their pending bills, I don't know what they are thinking of. Serious pending bills, uncleared bills, they have not paid bills from contractors, now they have not paid KEMSA, we don't know who else they have not paid. They have not paid community health workers in their counties. Surely, Mr. Speaker, there's something amiss. And I want to go on record. We are going to find a solution to make sure that health care in this country must be given a priority. Thank you very much. I support this bill.
Hearts in them. Does it mean that there are some that do not have Kenyan hearts? The Honorable Lesuda Naisula, member for Samburu West. It's your opportunity now.
Thank you very much, Mr. Speaker. First, I want to take this opportunity to congratulate and to thank my colleague, Honorable Owino, for this very, very significant and important bill, which is going to look at the welfare and how our community health workers work in our country. And just as it has been said by others, we cannot overemphasize the important role and work that the community health workers play in our country. And Mr. Speaker, just from the word community, these are the people who have direct access to the community. They go out of their way to reach the people, even in the remotest areas. I know, for example, in my county, Samburu, and how vast it is, but any other time, you'll always find a community health worker in the remotest village. And they also have a personal touch with the community members, Mr. Speaker. Also, the community health workers are people who actually do follow-up. They follow up on our patients. They follow up also on what was said very importantly by my colleague Honorable Kutun. They even deal with issues to do with prevention, on issues to do with malnutrition, on nutrition, on how our children are fed, and it also helps to reduce issues to do with child mortality, Mr. Speaker. And so we cannot overemphasize on issues to do with the role and the work that the community health workers play in this country. Even when you look at people who have illnesses that need close follow-up, for example, tuberculosis, HIV, they follow up with them and have conversations with them. They even guide them. They ensure that they take their medication and even advise them on the diets that they should take, Mr. Speaker. And so, on the importance of the community health workers, we cannot overemphasize. On the importance of this bill and the importance of it is then to ensure that their welfare is taken care of, that to ensure that they are also in a council. We have seen how the dentist board, we've seen how the doctors and pharmacists and everybody else, but we have forgotten the community health workers. And so, Honorable Wino, this is very important to make sure that we consider and we ensure that the community health workers are then taken care of in our communities. Mr. Speaker, I just want to pick up on an issue, and especially on what has been said about our county governments. And when you asked whether there are some governors who don't have hearts, or in how they what was said, it depends on how they treat people and especially what has also been said about even the pending bills, there are some who the pending bills will always go to issues to do with roads because that is where there are kickbacks, and it depends on which contractor you pay and things like that. But when it comes now to serious issues like this one, where there is nowhere where money will exchange hands, we will have difficulty in the implementation of this law, Mr. Speaker. And so that is where we have governors who have hats, who think of Kenyans and what to do, and there are others who will actually take this very seriously and ensure that immediately it is passed and the regulations are in place, then they will ensure that the money and the implementation of this bill will then be done for the benefit not only of the community health workers, but also the people that the community health workers will be serving in the counties and in the communities, Mr. Speaker.
The Honorable Lesuda,
and so I support.
The Honorable Lesuda, I have also even heard in other quarters that are those that are even heartless. They don't even have hearts.
We wonder what they use to pump blood, But it's a very serious issue, and it is something that, as a country, we have to look at. And this matter, even on pending bills, both at the national level and the county level, it has a human face to it. There are so many Kenyans who are going into depression. We have people who are also committing suicide. There are people who are being auctioned of committing their resources to deliver services and work to both national and county government, Mr. Speaker, and they are now left with huge loans and debts to pay and being impoverished. And so it is important that even as we discuss these matters of national importance, we also consider as a parliament, and we'll be looking at it very closely from the budget committee, and even as we look into our budget, on how these pending bills will be taken care of, and also that we will be factoring in important matters like this. And so I want to support overwhelmingly this bill.
The Honorable Mwali Ombithi, member for Masinga.
Thank you, Mr. Speaker, for this opportunity to be able to air my views on this bill. I want to thank our colleague, Honorable Owino, for this bill. It's a very, very important bill. Community Workers Bill number 2020, which seeks to establish a council for the community health workers. I want to say that this country has got very few health workers, especially the doctors. And the health workers comes very handy because they know every home, they know many, many, many people. If they are called to help, they are available for no fee, and they are not complicated. They don't say, I don't have fuel. They don't say, I don't have money. They go there to help the community that they have been trained to help. And therefore, this council, which is being enacted, we are seeking the enacting, will be so important because it will be doing periodically trainings. There will be registers. They will be licensed like any other practitioners, and so that they will feel like they are also professionals, not people that are being used for nothing, but people that are being used as professionals. And therefore, I feel this is a very important bill that we need to enact it and pass it so that our people can be helped. We have very few doctors in this country. Maybe one doctor is for 2,000 people. But the health workers are maybe one for maybe 100 people. which will be able to help them even to assist the doctors, to assist the nurses, so that people are not dying anyhowly for lack of attendance in the hospitals. You will find that before a person is attended by the doctor, the health worker has given the first aid. And that first aid is very, very important. Especially in the rural areas, you'll find that one has been bitten by the snakes or by some other animals. But the health workers will be very handy to be able to give that first aid before they reach the hospitals. And that will prevent them even from further injuries, because a first aid has already been provided upon them. And therefore, this council is required so that we have a regulation which can govern them, where they can be airing their views when there is no payment, because nowadays they work for nothing. Last week they called me in my constituency. They met all of them, and they want to take the governor of Machakos to court. And I told them, before you take them to court, can you first of all have a meeting with the MOH, so that we can find a solution before you start going to court. Because even the money for engaging a lawyer, they don't have. So in some of these teething problems, in some of these non-payments, so that they can feel that we are not working for nothing. So I really support this bill, and I pray the government will also be able to see sense in the workers that help the health practitioners to be able to put health in our people, in our communities. With those few remarks, I support.
The Honorable Mwalio, the real statistics for doctors to population rate, the last I heard is about 1 to 115,000, not 2,000. 1 to 15,000 Kenyans. We are in trouble. The Honorable Muliunge Mutemi, member for Mwingi Central.
Thank you, Mr. Speaker, for this opportunity. I rise to support this bill by Honorable Martin Owino. Mr. Speaker, the Constitution of Kenya 2010 provides that health care is a right for all Kenyans, and that should not be denied because of lack of doctors. Therefore, Mr. Speaker, this bill has come at the right time to support the Constitution 2010, which provides for the right to health care. Mr. Speaker, health care is a very costly affair. Every other day in my constituency, there must be a request for support on health care bills in hospitals and other kind of tests. And Mr. Speaker, because of that costly affair of health care, we have lost a lot of lives. Many people don't get access to good health care, and therefore they die because of lack of health care. Similarly, Mr. Speaker, there are also others who die because of lack of first aid. And first aid, in most of the cases, is not provided by medical doctors. First aid is provided by the person who is closest to you at that particular time of the incident of poor health. And therefore, Mr. Speaker, this bill comes to sort those problems, because community workers are all over. They are all over in the villages, and therefore they are the first contact to the sick people or those who get accidents. And therefore, this bill will sort these problems. Mr. Speaker, many times in my constituency, there are so many fundraisings on health, and they have even become more than school fees, and therefore this thinking is good to sort some of these problems. And I want to take this opportunity to thank His Excellency the President for also thinking louder on healthcare. He has come up with the universal healthcare, which he talks very passionately about it. And if this universal healthcare is achieved, and we also achieve this community health workers bill, then a lot of issues will be sorted out in the healthcare. Mr. Speaker, as you know, all the professionals world over are regulated, starting with doctors, dentists, nurses, pharmacists, lawyers, engineers, architects. They are all regulated. So why on earth were these community health workers discriminated? The Constitution does not allow discrimination. Why were they left out when all these other professionals were being regulated? So I must thank Martin Owino for coming to the rescue of community health workers so that they can be treated equally with the other professionals. And as you know, Mr. Speaker, regulating professionals is good so that the profession is not infiltrated by quacks. So the community health workers, in accordance with this bill, they will then be registered, and will even be knowing how many they hire in Kenya. They will be regulated so that their conduct is in accordance with the law. And there will also be continuous professional training for them so that they are in touch with the current affairs of healthcare in the world. And also, more so, they will be disciplined so that they also do not misbehave. Mr. Speaker, traditionally, all these people have been there. There have been midwives, you know, there have been even traditional medicine men and women. And where I come from, there's a gentleman who, when you get a snake bite, like today I've just received a message from my constituency, a child has been bitten by a snake this morning and has passed on. There is a gentleman in my constituency who used to be my mathematics teacher, but he has converted himself to a community health worker. And he treats snake bites better than even in hospitals. Yeah. When you get a snake bite and you go to that guy, you survive. And sometimes when you go to hospital, you die. So this bill is very useful to people like that, because they will then be recognized. And therefore, Mr. Speaker, I finally want to thank Owino for this bill and ask members of this House to support him and support the bill. Thank you, Mr. Speaker. I support. Thank you.
The Honorable Edith Nyenze, member for Kitui West.
Thank you, Speaker, for giving me this opportunity to contribute to this important bill by Honorable Owino on community health workers. These are community health volunteers who are lay individuals of varied backgrounds coming from various communities that they serve. They have actually only received very brief training on health problems, and they've volunteered to engage with the community. So let me say that they are actually doing a noble job, because to get them into this work of health working with the community, what people really look for is the interpersonal skills, which they have very good qualities. They are good listeners. They are people who can do counseling. So let me congratulate them for accepting to do this noble job. They are doing this, yet they do not have the necessary tools to do their job, but they do a very good job. They interact closely with the community whom they serve, and most of the times they bring awareness. Actually, all the time they bring awareness to the community, and in doing so, they bridge the gap between the community and also the health facilities, because some of them now are the ones who expose them to the right medication so that they are treated. But these health workers do not have, they actually do not have the necessary skills, they do not have the necessary equipment, and they also lack finances, because they are supposed to move from one place to another. They are supposed to actually travel. They also end up in having their clients. They are not even given airtime to reach their clients. And this is very, very wounding to them, because they are really ready to work, but they do not have the necessary skills. So, Honorable Owino, let me congratulate you for bringing up this need for the health workers. I remember some of them are also do some interaction with the community. I remember one of the health worker who usually comes to me. It's not one, but many. And this time they come asking for transport, asking for airtime. I remember one of them who actually interacts with HIV patients. And she's also positive herself. And she has a lot of work, and they also do a lot of work. The other time she was telling me of how they do not have the medication. She's the one who is supposed to go and talk to them, encourage them, and so that they do not give up in life. And I remember they were even telling me I should give them some money so that they can buy something for them. And this will make them feel that they are needed in society, that they are loved, because no one cares for them. And then whoever is doing this has no funds, has no financial support from anywhere. So it's very important to have these health workers be regulated, be under a body, even if it's an authority, which would, in the county government, which would actually regulate what they do. They would, in doing so, then they will be trained. They will be licensed after the training. They will have a payment structure. And also, it will be known how they are working. They will have some working schedule so that they are recognized from that. And then they will be reporting to someone so that they are not just left on their own. They will also be having they could also be having some refresher courses organized for them, so that in case of any pandemic which comes up, they are thoroughly trained to be aware of what is happening, so that they pass it to their patients and also to the community. So this is a very, very important bill. But currently, in some of our counties, like my county is Kitui County, health has been a big issue. There is no medication. People are very desperate. And yet, they're expecting to be treated. Even when they come up with medical cards, they don't work. You are given medical cards, and then there's no medication. You are still supposed to pay for the medical card, and then there's no treatment. So the health sector in the counties is wanting. So, Mr. Speaker, I would urge the government to look at it again and know whether it should be a devolved function or whether it could remain at the national level. Otherwise, my urge is that there is need to have these volunteers, to have the health workers get some pay and also have some money for airtime, for transport, and also have some recognition, like have the necessary tools, the tools which they would carry along with them, having some also identification to show that they are health workers, also having some uniform that would also assist them. So with all that, Mr. Speaker, I support the bill. Thank you.
The Honorable Nixon Korir, member for Langata.
Thank you, Mr. Speaker. First, I want to thank Honorable Wino for bringing this bill. This is the kind of the bills that we should be giving priority and discussing in this House. Mr. Speaker, the welfare of the community health workers have been ignored for a very long time. And yet they play a big role in our society in terms of bridging the gap between the community and the health facilities. They also play a role in prevention and cure. Mr. Speaker, we interact, especially in Nairobi, with very many community health workers who are working in our informal sector and in our community. They deal with the chronically ill in the community, those who have HIV, they ensure that they get their ARVs. They play an integral role in our health sector. And I think this bill has come at the right time, although it's a bit late, but I think it is the right time now. Mr. Speaker, there is no, just like my colleagues have said, there is no sector in this country that people just work without being recognized by government and being paid or remunerated for the work they have done. And I think the health workers have really suffered in the hands of the county governments, and we must say as it is, Mr. Speaker. And they also lack trainings. As you know, Mr. Speaker, diseases evolved, they mutate, and different trainings are needed to handle different diseases, and the case in point is the COVID. And these health workers have been volunteering despite the lack of equipment, lack of facilities and facilitation. And they have been volunteering in the community, and I think they deserve a thumbs up. And the proper thumbs up is ensuring that they are recognized, they are registered, they are trained, they have a representation in terms of a council that can represent them when they have issues, and proper recognition in law. And because they are the first reference from when you go to our ghettos, Mr. Speaker, most of the people don't even know where the health facilities are. The first person they call is a community health worker. And they go there without asking for any money. And I think it is only proper that we support this bill so that we can be able to, once and for all, deal with this issue and recognize our community health workers. And there are many, Mr. Speaker. What they just need is proper training, licensing, and clearly indicating their roles in whatever they do, and so that they cannot be misused and abused, Mr. Speaker, because for a very long time they were referred to volunteers, and I'm happy that now they are referred to community health workers, not community health volunteers. So while so many people are volunteering in different sectors, I think this is a very big sector. As you understand, many Kenyans have sold property. They have sold all whatever they have just to cure their family members. Many Kenyans die of curable diseases because we supported, and the first support that we need to give is the community health workers. And I support this bill, Speaker. In the case point of Nairobi, the current director in charge of health was a KMPDU chairman who was an activist fighting for the doctors. But now given an opportunity, Mr. Speaker, we've seen and we appreciate that many facilities have been built around our city, but they don't have medicine, Mr. Speaker. These community health workers have not been appreciated, and because you actually did not need a bill to be brought to this house. ECDs and the ECD teachers are being enumerated and paid by the county governments, and they didn't have to suffer the way the community health workers are suffering. And I think it is unfortunate, and we must support this bill so that the community health workers are supported, Mr. Speaker. I support.
The Honorable Wangaya Seka, member for Wisero.
Thank you, Speaker. I also rise to support this bill by Honorable Owino that seeks to create a council that will look into the interest of the community health workers. Mr. Speaker, community health workers link the community with health facilities. Community health workers also, Mr. Speaker, provides advice in terms of nutrition and general hygiene. In so doing, Mr. Speaker, this reduces costs of admission in hospitals, hence reduces costs of healthcare in general. Thank you, Mr. Speaker.
The Honorable Dawood, member for...
Thank you, Mr. Speaker. Mr. Speaker, on the onset, I want to congratulate Honorable Owino, and I believe this Community Health Workers Bill should go through, and if it does go through, Mr. Speaker, we need to empower the health workers. Mr. Speaker, the health workers who are already in the job, they should not be just taken for training. I mean, if they can suffice what training they have, it should be put in place so that the council does not say that they have to go to train, because community health workers are the backbone of this country. And I think when we have them where they have not qualified according to the training manual, they should still be registered and be given some time so that they can go for training. But otherwise, we need to see how the counties will support, Mr. Speaker.
The Honorable Odhiambo Akoth, member for Suba North.
Thank you, Mr. Speaker. Mr. Speaker, I wish to support. In my community, we call these people Nyamrerwas, and they do an excellent work, especially for reproductive health care for women who are about to give birth. They're the first line of response. Mr. Speaker, I've just seen Bill Gates writing about how we can stop the next pandemic or pandemics ever. And part of the issues that he's saying in a forthcoming book is that there are innovations and ways that we can do it. But from what you can see of COVID, we don't even need to go far. He mentions that we can invest in healthcare, but we need to invest in healthcare at that level. And we need to therefore appreciate them and remunerate them well and take care of their needs. So I thank Honorable Martin Owino for this excellent bill. I support.
The Honorable Gogo Achieng.
Thank you so much, Honorable Speaker. I rise to support this single most piece of legislation for the simple reason that it's been fronted by a first-time member of parliament from Homa Bay County, Honorable Owino. Thank you very much. I've gone through the bill and it's a very good piece of legislation, but allow me to just talk about two items on it because we are short of time. One is about recognition. All people want is for them to be recognized. After all, they've been working for the longest without recognition, and when they are recognized, I think it should motivate them to work even better. Kenyans, we are used to free people working for us for free. And it's high time, Honorable Speaker, that we recognize these people. They are given more training, they are licensed, and when their work is anchored in law, then it's high time they are going to be paid, and more training is going to be given to them. Honorable Owino, thank you so much for bringing this item on the floor of the House. We support, I support. Rangwe constituency supports this bill. And because of time, I think when given more time, next time I should speak to it more.
The Honorable Gogo, don't rush yourself.
Thank you so much, Honorable Speaker.
There's still time.
Oh.
I just want to inform you
okay.
that when this bill still has about 1 hour, 18 minutes to go, and you are on the floor, and therefore when the bill again is set down for consideration, you will have priority and you will have a balance of about 9 minutes to speak to this.
Thank you so much, Honorable Speaker.
Just hold your thoughts, and I know you have a lot to say. You will say it then.
Thank you.
But you'll allow us now to, because of the time for this particular session, to call it to a stop.
Thank you, Speaker.
Thank you. Honorable members. (02 p.m.) This House stands adjourned until today, Wednesday, the 9th of February 2022 at 2:30 p.m.